Good morning and welcome back to Morning at NTV. My name is Idris Matusegawa, and right about now we have entered the Kickstarter segment of the show, where we shall be discussing how the COVID-19 second wave has exposed some inequalities in the health sector. Now, health facilities are currently in the line of fire, being tasked to explain how some private facilities like pharmacies have gotten access to the COVID-19 doses that were meant to be free and were imported from countries like India, but are now being sold. Like earlier, we reported in our news story that we talked about the spokesperson Enanga currently saying that some 803 doses were raided in Mulago, where some pharmacies were found to be selling some of these vaccines. Now, to speak to us about this and more, we have Miss Allana Kembabazi, the Program Manager, Right to Health at the Initiative for Social and Economic Rights. Welcome and morning, Miss Allana. Good morning.
Good morning, and thank you for having me, Idris.
I must say, you look lovely today.
Thank you.
Well, first of all, Allana, you as ISER have released a document that is explaining how government should curb the pandemic. How should they fight? What are some of the things that you have highlighted in this document?
Yeah, so we think that there are 10 things that need to be urgently addressed that everyone is really worried about and that are really showing the inequities we have in the health sector. Yet we do recognize that everyone should be able to get healthcare for us to fight this. The top of the list has been, in the last couple of years, has been limited access to testing. As you well know, the testing sometimes is not there in the public facilities. In Namaingo, for example, I was hearing people were dying but were unable to test because they didn't have the kits. But then you go to the private and the average cost is 200 to 300,000 for a PCR test, which most people cannot afford, especially with the biting effect that COVID-19 had on people's incomes. And so what you end up finding is that people, when you get some symptoms, you either stay home and take herbs and try to be responsible, or you keep moving about and we keep having continued spread. And as you well know right now, the government has been trying to do some COVID-19 vaccination, and you've talked a bit about that. And ideally, if you are doing testing and you're getting ahead of vaccination, you'll be able to reduce the spread and isolate people and avoid the surge that we have right now. But that hasn't gone too well, as you're well aware. When vaccination came, there was, first of all, inconsistent messaging. You require national ID, you won't require national ID, maybe you will. Priority groups will go fast, but then people are being allowed to jump the queue. And to make it more troubling, they outsourced, when the vaccines were supposed to be free, they outsourced them in a lot of ways, some of the supplies to the private sector, and sort of lost stewardship of the process. A couple of weeks ago, we began getting reports that vaccines were being sold, and now you're seeing that they are cracking down on different people. But these are all things that could have been avoided. We've also never really had what happened to the additional doses. If you recall, in February, Parliament passed a supplementary budget of $5 million as a down payment for 18 million Serum Institute doses of COVAX from Serum Institute. And some of them were supposed to arrive in March. Now, we know that since then, there's been a shortage with India, and doses were put on hold. But what happened to those initial doses that were supposed to arrive in March? Because we really needed to be working as quickly as possible to vaccinate everyone. And right now we're hearing them say some doses are coming, I think from Italy of AstraZeneca. But as you can see, we again, the government should be doing everything possible to secure as many doses as possible. Because in a small country like ours, we only have had 10,000 cases in 10 days, and our health systems are they're completely overwhelmed. This is the beginning of the surge, and they are overwhelmed, and that really concerns us. So vaccination and testing could have avoided that. But now that we are here in the heart of this pandemic, top of people's complaints and their concerns and the reports we're getting has been failure to ensure affordable and sustainable oxygen. Now, some people will tell you, yesterday I had Mulago saying, our systems were not built for this. But the truth is, from before, Uganda, by the way, has a strategic sort of implementation plan around oxygen. I can get the full name for it. It has had it. And that document tells you very astutely that we are nowhere near where we should be in terms of oxygen. I think it said only 36% of facilities had the oxygen initially from before COVID. Now, when COVID hit, we knew for a fact that if people get severe illness, the most effective thing for them initially, and it's been discussed all over, has been access to oxygen. So we should have planned for this, and a lot of money was given. You know, the ministry or other government entities would come to parliament. So many supplementary budgets were passed. So how did we get to a point where we haven't hit the peak of the surge and oxygen is running out? And some of these things are things that could have been done better, you know, like making sure that there are, you know, plants, proper functional plants at every regional hospital. Thinking through that, okay, if a surge happens, what are you going to do to increase supply? It's only yesterday that we're hearing them say they're going to now work with manufacturers to think about how to convert industrial oxygen and purify it and be able to meet the surge. And UPDF is going to do this. But that was this weekend. When I was speaking to you all on Saturday, again, access to oxygen, they were not saying anything. And people were telling us, either you go to the public and they are completely out, you go to the private, they're telling you to come with, either some hospitals say come with your insulin cylinder, that's where they have reached. Or you buy it on the market and people are paying up to 3 million for a cylinder. And then you have to do refills, right? And again, where does this leave the ordinary Uganda? What does that mean? It means that only those who have means will likely survive this pandemic. The other thing that is tight oxygen has, of course, been also access to adequate ICU. We are running, you've been hearing this, we are running out of space. But then we had a plan. Again, money was, people came and asked for money. And they said we are going to step up beds, so forth. So again, we were unlucky. Unlike other countries that were in the eye of the storm last year, for us, we had a whole year where we were not hit in a bad way. I mean, for months, we thought COVID had gone. I mean, that is the time when you step up. It's like God said, you're a small country, I will give you a chance. And we have squandered that chance. And again, money was passed. And it's important that, because from the public's perception, people are saying, okay, we didn't just even give money in budgets. We also contributed. We did, you know, everyone was like, let's come together. So come and tell us, where did the failures happen? You can't come and say, oh, there are too many cases, and that is why we don't have ICU space. Do I agree that there's a surge? Yes. But is that the only explanation? I don't think that's the only explanation. And the last bit, of course, is always who gets to, you need the health workers, right? And let's reflect, how have we treated our health workers? You've seen them in interviews, in talking about strikes. You've seen them asking for allowances. You heard recently that they're getting 5,000 a day, an additional allowance, you know, for risk allowance. As in, you've seen the ways in which we have devalued our health workers by failing to ensure that there's proper protective equipment, by failing to ensure that they're properly remunerated. And now we need them to put their lives on the line for us. We also need more of them because a lot of these places have, you know, just a shortage. And when you get to ICU, you need the intensivists and just a bit more sort of consideration. So again, I recall Honorable Cheng at the beginning of the pandemic coming and saying, these are the things we need to do. And they were echoing a lot of this. But a year later, we don't see the progress that we should have been seeing, and we need government to prioritize this. Then, of course, because they're always emphasizing prevention, water, access to water, which people have been talking a bit about and complaining about throughout the last year, but we're also talking about who is left out. If you're in the urban slums, do you have a good access to water? If you're in areas like Amudat, because one of the things we're trying to do is, yes, treat those who are sick, try to slow the spread because our health systems, we all know, cannot take it. But the basics on water is not there. And then as people think about how we've been prepared, top of everyone's agenda is, you guys, what did you do with the COVID-19 money? To date, we have not seen accountability by government for COVID-19 funds in a comprehensive manner. We know that there was an Office of the Auditor General report that found irregularities around this. Some ministries even got a qualified audit. And remember the discussion around the tents that came, that were very expensive, and then they flew. You know, people began asking, okay, well, who actually even got the tender to supply, come up on an oxygen plant? So there's a lot of questions right now around accountability for COVID-19 funds, and government should come out very clearly and tell people about this, because as long as you don't, citizen trust remains very low, it remains eroded. So when you tell them do something, they don't trust you. Every time I talk to people about COVID prevention or this, they say, do you know that thing was a hoax? Because did you ever see them? Has anyone come and told you what they did with our money? They built apartments. Have they come and told you? And that's exactly the outcry I was hearing yesterday. People are writing to me and saying, how do we get a point where they're telling us no oxygen, no ICU, and we haven't seen accountability for the money? Surely these are things that should have been prioritized from the onset. And the other thing, like you've spoken very clearly about, has been the lack of regulation of any other actors in this space. In this country, we tend to forget that healthcare is not a good. It is a right. It is essential for life. And not just that I get healthcare as Allana, who is privileged. If the worker who works for me, the housemaid, if they don't get healthcare in this pandemic, we are going to be universally affected. We will not fight it. And so that means that any actor who is in that space must be regulated. And the regulation starts from the basics. First of all, if you're going to say you're giving them vaccines, are you monitoring this? How do vaccines get sold? How do they get stolen when people are lining up in thousands? But let's look at what is happening right now. How much are people being charged for testing or treatment? It has gone into a whole new level. Some facilities will say minimum 10 million deposit, and then we'll give you you'll pay for the other things. People have said they paid 78 million in 3 days. You people, how many people will be able to afford this?
Ms.
There
Allana,
has to be at least a price cap. It cannot be business as usual. We are in the middle of a pandemic. And I've seen that in other countries, there have been price caps around this.
Yeah.
Also quality. You find that in the private facilities, I've been getting a lot of reports about certain entities that give false positive tests.
Ms. Allana, sorry to interject.
Also pay for the doctor
and Ms.
all
Allana,
other things.
Ms. Allana, sorry to interject. From what you're saying, there is a lot that has gone wrong, and we have come from an exemplary fighter against the COVID-19 to being overwhelmed. Before I let you go, what are some of the things that you do recommend as ISER in a minute? Just tell us, what do you recommend as ISER that should be done so that we can play catch up?
Yeah, but for me, top of the list right now has been oxygen. That is the immediate, stepping up the supply, making sure that there are oximeters at the lower health facilities so they can detect very quickly who requires oxygen, and they need to sort of make sure they're getting ready of any barrier to getting oxygen. In the Indian court's words, beg, borrow, we don't care, get the oxygen. So that may include removing tax barriers that there's debate about whether or not they're still there, particularly for cylinders and not just medical equipment, and really just stepping up the supply. And I know they're beginning to think about that. Number two has been ensuring ICU beds. This is again top of the list. People who are sick, just being able to get space. We've heard about other spaces being opened up. When are we seeing them? Three, quick access to vaccines. It's very important that government doubles down, addresses the issues with implementation, get vaccines out to slow the spread, and finally, accountability for COVID-19 funds. Because that is going to push us to have the discussion we need to do. But I want that government, sorry, just one last thing. Who they are working for. It can't be the elite. Yes. The poorest people must be able to survive this pandemic for us to be serious as a country.
Indeed. Thank you so much, Ms. Allana Kembabazi from ISER. The conversation still continues. This is a very serious matter that we are facing worldwide and especially here in Uganda. Now, to continue with the conversation, just go to our social media platforms. That is Facebook, Twitter, or YouTube to talk about, suggest some of the things that maybe the government should do to combat this pandemic.